So who wants to go first? All right, Jane.
I sort of have a general question to whoever wants to respond. Oh, Jane Lipscomb from the University of Maryland in Baltimore, and I'm the director of the Work and Health Research Center. There's been several references to labor unions' role as potential collaborators, and also, I guess, some of the history of them, not necessarily being part of the same coalition in terms of the consumer-directed care. But I want to know if those of you that are doing research in this area are collecting data on the union status of some of the workers that you have access to, or groups of workers, and looking at what the impact of much of the work SEIU has done on sort of both sides of the equation in terms of the quality of care and, the stability of the workforce and the job satisfaction of the workers.
Okay, that's a great question. Bob, you want to?
I'm really glad you asked that question, because we haven't had any controversy at all so far today. Unionization can be a good thing to the extent it brings benefits, and there's some evidence that when that's occurred, let's take example of California, the public authority model, where it has actually done that. But I should also add that that by itself doesn't guarantee success. Los Angeles County, which is about 40% of the PAS recipients in the state, has among the lowest wage rates in the state. The Bay Area, which has a much more enduring sort of union mentality, pays up almost $2 more higher per hour. So it's not just unionizations, it's not just SEIU or that kind of effectiveness, but beyond wages, I think some of our concerns have been to try to get other benefits available to this population, and sometimes you are competing with the independent provider side against the unions in terms of those interests. I mean, the issue of occupational injury, access to workers' comp and other kind of insurance benefits, how those flow and or how they're accessible through an IP model sometimes does run into issues that have to be negotiated with organized labor. And through the public authority system, I think we have a mechanism for doing that. I'm not sure that would be equally available in some other structures around the country. Oh, Teresa, now want to rebut that? No?
Can you hear me? Where workers' comp is not mandated by law, 2 or 3 states. 2 of these states have it expressly because of collective bargaining agreements. And one thing I just wanted to put it out there is, in several states, most notably California, but in Illinois, Oregon, and Washington, the collaboration between SEIU, AFSCME, and consumer groups has resulted in a sustained coalition that has resulted in not only higher wages and health benefits and workers' compensation being provided, but I think a transformed ideology of partnership and working together that goes beyond just sort of lip service and actually produces that kind of quality jobs, quality care process that we're all striving for. So I just wanted to put that out, that unions have played a major role in working with consumers, and consumers have sought out unions, and I just think it's a positive thing. And it can be problematic at times, as some of the speakers have mentioned, but I definitely wanted to put out that there's definite positive aspects.
Okay, thank you. All right, here's a question back here, Teresa. Could you speak in the mic?
Yeah, sure. I'm Ron Osterhout. I am the Public Authority Director in Los Angeles. And the state, as Donna and Mike know, does provide the workers' comp under statute. And also the comment that about our wage rate. Actually, we have a $9 wage rate in Los Angeles right now. It's gone steadily up, but it's all dependent on what the Board of Supervisors appropriates for funding. But it still is below San Francisco, no question. Donna's public authority is higher than ours. And, with time, I think LA County will get up there, but I have 125,000 providers in LA County, which is substantial, well, along with 160,000 consumers. So it's a big number, but we're making progress in LA County, and we're getting them up there, and we've added medical benefits, which I provided Steve with a copy of the study I've done for 5 years on where we've been able to stabilize the workforce using benefits. Not everybody has them, but the ones that are eligible, at least we've made a contribution that way. Anyway, that was just the comment I wanted to make.
Thank you very much. That's helpful.